want to talk about Medicaid first. If it was an ideal situation, what would your proposal be?
Well, ideally, I think we'd have a program that met the needs of those that were just the most vulnerable and those that met the healthcare needs of whatever situations we were dealing with at that time. I think what we would love to see, I think, and I think Representative Coleman agreed with me on this, is that we're trying to seek out what would be the most cost-effective system, one that would promote healthy behaviors and so forth, but still be there for when people fall into hard times with situations related to their health.
And what do you think the ideal situation would be?
I think the ideal situation is funding current services for the people who have needs and trying to cover the needs of the people of the state of Texas. I know that my colleague wants to see the same thing. The challenge that we have is we just don't have the money to do that. So we have to figure out more innovative ways to take care of the needs of the people of the state of Texas till our economy rebounds.
Obviously, there are going to be cuts to Medicaid. What do you see as the priorities?
Well, I mean, the priorities are to keep the physician rates and the provider rates to a level that keeps those providers in the program and providing care to the seniors and children and the folks who need health care and human services. That is the key here. And we all know in Medicaid, it's not the recipient that gets money, it's the provider. And with rates that are too low, that provider just won't participate in the program. And we know that's the objective.
Are there certain areas of the budget, agencies, programs that you would?
In the budget? Well, I think we're all concerned about the same thing. The one that's most at risk is probably mental health, because mental health in Texas is a part of the indigent care system and is paid for mostly with state general revenue. And so we have to find some solutions that actually help by bringing in some federal funds. Where we ordinarily spend only state funds. I think that's the most at risk because it has the most general revenue in it with no federal match.
And also, it also has the ability to impact our criminal justice system. And so, as some of my colleagues have said, people with mental health issues are going to engage the system somewhere. The question is where they're going to engage it. At some point, they may engage it into the criminal justice system. And right now, the place where most of the mental health is delivered in the state is, in fact, in the jails. That's probably the worst place that we could be doing it, frankly. So the state, at least in the short few years that I've been serving, has made some progress towards meeting some of the needs in mental health. At a time now where we are finding ourselves in less economic desirable situation, as Chairman Coleman has said, this then now puts us in a situation of having to look at those things that the state pulls back from that doesn't compromise federal funds. Mental health is an area where we don't get a lot of federal funding, in fact, and so it begins to be that place you look to cut back because you don't compromise those federal funds. I think it's incumbent upon us to keep the bigger picture in the line of vision here, and that is that if we don't do these things, and if we don't continue to address mental health, we are going to address it in a much more expensive place in the system, whether it be in an acute care hospital area or whether it be in our criminal justice arena.
If the state can't address mental health, are those federal funds going to be available?
Well, actually, no, because we have to make sure to move populations where they're eligible for federal funds. Those federal funds only come if we move those populations. So what happens is, as Chairman Zerwas has said, in Harris County on any one day, 2,500 people in the jail are there because they have mental illness, 2,500. So that's running up the cost. If we can divert and treat, or if somebody has insurance that doesn't have it now, then there's a payment that goes with that. And so that takes some creativity. These funds are matching funds from the federal government, and so we have to look for new sources of funds to match, to use as a match for those federal funds.
And the state of Texas, as you may have heard us call ourselves, we call ourselves a donor state. We are a state who sends more money up to the federal government than we get back, and there's a whole variety of reasons for that, but at the end of the day, we need to be looking for ways to be sure that the taxpayers' money that goes to Washington comes back to the state of Texas for the benefit of Texans. And Chairman Coleman has really been a great advocate on that in that regard. He has been a person who's been up in Washington, D.C. on a regular basis prior to us convening here, and has been a real champion for trying to find those ways that Texas can continue to draw down the funds that it should be getting. And frankly, I would say he's been quite successful in that in a number of different ways.
When we're looking at the Senate's plan for the budget, it seems like their cuts to, education, Medicaid, Health and Human Services have been less severe, the proposals at least. Is this something that's actually going to be a reality when you compare the House and the Senate?
Well, I think one of the things that the Senate has done is that they have identified other sources of revenue. And I think that's what we all need to be about doing. I think if you look at the difference between the House and the Senate budget, the House budget reflects some very serious efforts at generating cuts, if you will, that meets what we consider the biennial revenue estimate to be. And so the budget that the House has before it is one that, without any other sources of revenue, in fact, pretty much balances out. The problem is when you get down to looking into each of these strategies, and especially in the healthcare area, you see just how severe these cuts are. You see nursing homes that are going to have a hard time staying in business. We're going to see many people fall off of our ability to treat mental health. We're going to see people fall out of certain programs that have typically been there for them and stuff. And the consequences of that is that when you stop these services that we know have value up front, again, people engage the system at a higher cost arena, i.e. the emergency rooms or the acute care hospital.
And some people are calling some of the senators heroes. Do you think that once we kind of get to the end of the whole budget process, is it going to be the same?
Look, he's going to be there negotiating the budget. Everybody accounts for things somewhat differently. Let's just say there might be a little puffery going on the Senate side. But that all shakes out when the two houses come together in the conference committee. If it is a little bit of puffery, if the money is not there, it's just not there. They can say it's there, but that doesn't mean it's there. And so in the final analysis, what I appreciate about the House budget is that we know that the money that we know is there is in that budget, and there's some decisions to be made, but this is just the bald-faced truth. And I think that's the important part. There's nobody trying to obscure the reality. And that's people need honesty. That's why I like working with the chairman, because look, in the final analysis, we're here to work for Texas, but we can't do it saying that a circumstance is not what it really is.